With these new drugs, they're so easy and doable for people. There's really no reason why we can't eliminate hepatitis C. The barrier and the big problem is there's a lot of people out there have got it and don't know they've got it. We need to find those people. They need to get tested, because if they get tested and know they've got it, they can get rid of it very quickly, very easily, very safely.
It's about partnership working. We need the hospitals, the clinicians, the nurses, the prison officers, the drug services, the homeless shelters, the guy out in the van. It really is about joining up all the pathways and doing this together. It sounds a bit hippy-dippy, but actually it doesn't work with us on our own. It's not going to work with the hospital on our own. It is about all of us working together.
I think we need to get in the GP surgeries. So I think that's a place where we're missing thousands and thousands of our outcomes that come from GP surgeries.
We need to have a multiplicity of areas where service users can approach for treatment. So I think it's great to be able to treat people here, but I was quite struck. I went and sat in on Janet Catt's clinic, and nurse consultant at King's College Hospital, and she was seeing people who wouldn't come to an addiction treatment service, indeed aren't engaged in addiction treatment, but they're going to King's to get their treatment. I know the same thing has happened with Terry Wong in St Thomas's Hospital and Dan Fortin in George's. They're finding the same thing. There's people who aren't engaged in addiction treatment who are willing to attend treatment within the acute sector.
What the NHS framework says is that we should be reducing morbidity and mortality in these groups. So that's there. There's the law and the acts and the government policies. That just needs to be implemented by commissioners instead of like what's happening at the moment. Provision of these type of services is being reduced. I understand it's being reduced across the board, but this particular group, so we've doubled treatment in the past year to 6%. 6%. So we've got 100,000 people, we know who they are, where they are, a condition that can kill them. 3% a couple of years ago treated and doubled, and everyone's patting themselves on the back that they've treated 6%.
There needs to be kind of an attitude shift for the people that still want to carry on injecting drugs, you know, instead of driving them away and leaving them to feel ashamed if they get reinfected. We need to be embracing that. We need to show them unconditional positive regard, bring them back in.
We're going to really need to reach into communities that thus far have not been on our radar, people that might not want to engage, and if we're going to engage them, we need testing that's just out in the community and a response to testing that's immediate treatment. And if it can be that simple, we can start to get through those people. We've got you now, let's test you, let's give you these pills, done.
Even if you feel ashamed, you know, you just need to put your feelings aside and go out there and get yourself tested, because hiding away and shutting yourself away isn't going to help you.
There is so much work to do, and we have this window of opportunity to do it. How amazing to be a part of the elimination of a disease. You know, to sit here, you know, and I might not be around to see my grandkids be this age. God, I'd be so old. But for my grandkids to know that I had something to do with that elimination of a disease, there's a footprint to leave.